let's talk about this new report that has just come out. Um, there's so much to unpack with this on a national level, but it just suffice it to say, it seems as if being a caregiver is still as stressful today as it always has been. Is that the case?
It is the case, and I think if you compound the caregiving duties with the dementia diagnosis, those caregivers report higher levels of emotional stress, physical strain, especially as the disease progresses. The need for more intimate interventions and more, physically demanding interventions is needed, of course. And then just the lack of support systems. A lot of people feel isolated, particularly here in Arkansas. What complicates that is individuals who live in rural parts of the state who have limited access to support services, respite services, and are unable, quite frankly, to leave their loved one at home so that they can care for their own physical and emotional and mental well-being as well. And so I think those compound for dementia caregivers. There's just higher levels of all kinds of stress, and I certainly see that with my mother caring for my dad.
And same with my dad caring for my mom. It seems like that number has either gone up or stayed the same over the years. So what can happen or what can be done to help with these caregivers?
Well, here in Arkansas, we've taken a unique approach, and we have established a dementia respite caregiver grant program. And these grants are designed to serve the needs of individuals with a specific dementia diagnosis. There is no income requirement for this. And what we have learned in 2 years of doing this grant is that the majority of our caregivers, close to 70% of our caregivers, when they take the grant and they are able to acquire respite services, typically what they are doing is caring for their own, attending doctor's appointments, spending time with other family members, and it's limited funding. We only have $200,000 a year to administer this grant, so at the most we can serve 400 families. But the responses have been pretty alarming. People are attending again to their own personal needs, caring for their family members, taking care of household obligations that they otherwise were not able to do. But the majority of them, again, are trying to just take care of themselves with their break.
There are 155,000 Alzheimer and dementia family caregivers across Arkansas, and the amount of care totals $4.5 billion. Am I reading that correct?
That is correct. We did estimate that they provided over 270 million hours of unpaid care. And the value of the care that they provide for their loved ones, again, is a cost savings of $4.4 billion. And what we are seeing, and as you know, that when someone receives a dementia diagnosis, typical caregiving duties fall to the family and the friends first. And as people are making decisions to age in place, the state needs to continue to empower caregivers and families to give them the options to make these decisions, to be able to care for their loved one at home. And again, dementia caregivers take up a significant aspect of our state's population. And as prevalence continues to grow, the value of the care they provide is also going to increase. You can see based on our 2020 figures, caring for someone with dementia costs the state Medicaid program $396 million. Those costs are going to continue to rise. So if we empower caregivers, we're able to delay spending in more costly care settings if we're able to keep them at home. So the state needs to continue to invest in home and community-based services that empower caregivers and families to make those decisions.
That was my next question. How does this affect state funding?
Sure, it's been challenging for us to get an increased our funding levels for the caregiver respite grant program as one example we could draw to. Our funding levels have stayed flat for the first 2 years of the program, despite its success. And what we are seeing from just our analysis of the data that we've received is that our grants are primarily focused in the metros. So we are not able to reach the rural parts of the state. We certainly are not hitting portions of the Delta, Northwest and Northeast Arkansas and these siloed rural communities. We do not have the funds to be able to reach those communities. Our grants expire usually in 7 months. We run out of funding. So the need for more funding, particularly for this program, is certainly something that we're advocating for as we go into the fiscal session here in Arkansas. And then again, across the boards, other states have been more aggressive in their funding of home and community-based services. Programs similar to ours received close to $800,000 of funding in Kansas, $4 million in Missouri. Tennessee's appropriation is $1.5 million, and we're having to do more with less with 200,000. So you can see our surrounding states are doing a much better job funding interventions like respite. We certainly see that the legislature sees value in it, but we need more funding to be able to expand our reach because we are not even, tipping the iceberg when it comes to reaching enough folks.
So that really is a putting pressure on the legislature, so to speak, and portraying the need for that extra funding.
Sure. Yeah, the legislator needs to respond. We need right now. The Department of Human Services has funded this grant with federal block money. So the state has not really contributed at all to this program. We are asking the state to match the federal funds of 200 with 200 of their own from state general revenue as we go into the session because our caregivers need it, our population needs it, and we need to expand our reach of the program. Our analysis has shown that we are hitting those caregivers that make too much money to qualify for Medicaid services, but they don't quite make enough to be able to afford in-home care. And so the majority of our participants have fallen into those service gaps, and this grant has been uniquely designed to specifically serve those folks. And it's performed at that level the last few years. But we know that we need to expand capacity.
Does the respite care for caregivers, does that include finding support groups, or is that something that is separate from this, but still very much important, very much needed for those caregivers?
So it is separate. I mean, that's an initiative of the Alzheimer's Association to continue to expand access to support groups. We do have two virtual statewide support groups that are performing pretty well. But we continue to look in communities where we don't necessarily have a footprint to expand access to support group services. On the respite grant program, the funds, caregivers are able to receive $500 grant funds. And those funds are primarily used to, again, acquire respite services. But what we are learning is in the rural areas, families are struggling even to find caregivers to come in and be able to provide the respite. And so there are access issues that we need to solve across the state. I really am concerned about our rural areas because those individuals are living in silos and they're on their own and in islands, and we need to be able to reach them.
Yeah, so not only are the folks who live in those rural areas feel like they're on their own, but at the same time, because they are in a rural area, it's hard for them to find someone to come in to help them care for a loved one.
Exactly. And I think that compounds the medical issues that our rural caregivers face because if they cannot find access to respite services, they may also have challenges finding and locating a primary care physician in the county they live in. We still have some counties who do not have a PCP. And so practitioners and all those are filling those service gaps. But if you cannot find access to respite, and that goes on to another piece of this puzzle, if you do not have access to diagnostics, per se, you do not qualify for this grant. And so you can see how this is a trickle effect. If you can't get the diagnosis, you certainly can't get services. And so access to diagnostics, access to care and support services is a need that we have here in the state. And as the report suggests, Arkansas is one of 13 states that are listed as a neurological desert. So there is a lot of areas where the state is vulnerable that we need to continue to address as our work goes forward.
All right, so now that we have this big old huge report, what do you do with it?
That's a great question. We certainly are leveraging the report to talk about the needs of caregivers. This certainly highlights the adverse effect of dementia caregiving on our population. We certainly hope that lawmakers pay attention to the needs that are out there. We see a possible solution that we've brought to the table to continue to strengthen our respite grant program because I do not feel like it is everything that we could give our caregivers. So we need to continue to work to expand those services. We also need to look at HCBS on the HCBS side, just to continue to make sure that we have access to assisted living services, long-term care, to make sure that individuals in rural areas have options when they have care plans. So the hope for this is to, again, expose the need of dementia, the rising prevalence of dementia. Arkansas has not even seen the beginnings of what we have referred to as the silver tsunami as more baby boomers continue to face retirement age. These numbers are going to rapidly increase over the next 5 years. And we've been sounding the alarm for the last 5 or 10 years about the need and the pressing need. And now that the crisis is already here, state lawmakers need to respond. And so we're hoping this report again highlights the prevalence of our disease, the need for access to care, the need for more awareness around the importance of early detection, diagnosis, risk reduction, because the science is strong. There are things we can do in our life to diminish our risk. And so we need to get ahead of the curve. If we do not pay for early interventions, access to lower cost of care, we are certainly going to pay for it down the road when we have to face long-term care placement and placement in more costly care settings. So you either pay for it on the front end or you pay for it on the back end.
Are we getting close to being too late?
I don't think it's ever too late. I think we are slow to act. We tend to react to issues when they become issues and emergencies. In our disease, across chronic conditions, we feel like the state could be more proactive in terms of driving risk reduction, the importance of early detection diagnosis, so that families don't end up in a caregiving crisis. The earlier you diagnose the disease, the more time families have to establish a care plan. The report also highlights the complicated healthcare maze that exists for caregivers. We know this and with regular diseases, but when you come back to the complexities of dementia, navigating the healthcare maze becomes even more complicated. And so anything that we can do to again incentivize providers to have a more comprehensive approach to dementia care, the better it's going to be for our population and the patients that we serve. So we need to continue to push the needle. I do not feel like it's too late. I feel like we are at a sweet spot. We have argued to lawmakers and to state agency officials that Arkansas is uniquely positioned to lead on this issue in the South if we'll take advantage of the moment. We have made great strides over the last 5 years to increase dementia training standards across care settings. We've established an Alzheimer's and dementia state plan. But our work is far from over. We need to continue to work on strengthening our infrastructure and also strengthening our public health response to Alzheimer's and all the other forms of dementia. We know that the health department and public health officials have the ability that when they engage on an issue to create change. We saw that during the unprecedented pandemic. And now that we're under the PHE, we know that the agencies are very capable in their work. We just need them to engage at a higher level so that we can continue to work to spread education and awareness around the importance, again, of early detection, diagnosis, and establishing care plans and risk reduction.
So much to this report, David. Thank you so much for your time. Sheds a whole lot of light on the problem in Arkansas and what's being done to fix it, hopefully. I appreciate your time.
Thank you so much.